This is Heidi Hartmann from the Institute for Women's Policy Research, and it's my pleasure to welcome you today to our webinar on work supports and health, specifically looking at the minimum wage, but also some other pro-worker and pro-family policies. We're very happy to bring this webinar to you. This comes from our hub, a joint project of the Institute for Women's Policy Research in Washington, D.C., and the University of California-Berkeley. I am the co-principal investigator. I'm here at the Institute for Women's Policy Research, and Will Dow, the other co-principal investigator, is with UC Berkeley. And we have 3 speakers today that I will be delighted to introduce you to in a few moments. But first, I want to take care of some housekeeping. So we've been joined by the group today, and we're thrilled to have you. I should mention this project is funded by the Robert Wood Johnson Foundation, and it's part of their Policies for Action, which is a whole program of grant making that they have to use policy and law research to build a culture of health. And we are delighted to be a part of that. So now we want to turn to the housekeeping. Your lines will be muted for the duration of this call. However, that does not mean that you cannot ask your question. You can do that by going to the bottom left of your screen. You should see a blue chat icon and a hand icon. And if you're having technical issues, please reach out to us by clicking on the hand, and an administrator will assist you. If you're unable to see the screen, you can call the Ready Talk support team, and that number is 1-800-843-9166, and you dial 0 to get to the support team immediately. Again, it's 1-800-843-9166. If you have questions, you can submit them at any time by clicking on the chat icon. Unless it is a clarifying question for the current presenter, we will answer the questions during the Q&A session at the end. The webinar will be recorded, so you'll all be able to follow up after the webinar with a link to the recording and the slide deck, which will be on the IWPR website. IWPR.org is our website. I want to thank Jeff Hayes, who's going to be handling the online questions for me. I will be moderating. And I want to thank Elise Shaw, who organized the webinar from our end, and also Leah Woods, who is our communications person at IWPR and is helping with the technical support and setting all of this up. I want to also, of course, thank the speakers. I'll just briefly give you their names, but I will introduce them later. Dr. Anna Goody is the research economist at the University of California-Berkeley. Dr. Lindsey Bullinger, an assistant professor in the School of Public Policy at Georgia Tech in Atlanta, Georgia. And Paul Sohn is NELP State Policy Program Director and the Director of the NELP Action Fund. To start, I want to just give you a very, very brief overview of the importance of the minimum wage to women. So I could use the next slide, I think. Or the first, is everybody seeing a bar chart? I'm not quite sure what everyone is seeing. I don't think I have the same screen as everybody else right now. In any case, workers are paid an hourly earning at or below the minimum wage by gender and race and ethnicity, and this is what this chart shows. Women make up 2/3 of all hourly workers at or below the minimum wage. And we can also see that this is true within every racial group. Among whites, there are more women than men. Among blacks, among Hispanics, and among Asian Americans. This is for the workforce age 16 and over. So the minimum wage is definitely a women's issue and very important, of course, particularly to female-headed families, but to all low-income families. We can also see in the next chart, which is a pie chart. Do we have that one up? That the majority of workers earning at or below the minimum wage work in food preparation and serving occupations, the big red area there. And you can see some other areas as well, personal care services, cleaning and maintenance, and so on. And I think that's, and then the final chart that I have is showing that the real value of the minimum wage adjusted for inflation has fallen quite precipitously. It's well below where it was at its peak in the late 1960s. It had a value then in today's dollars of $10.54, and now, of course, it's at $7.25, and it's been there for more than a decade. So it's particularly discouraging for low-wage workers. However, the good news, and I'm sure Paul will have more of this to share with us, more than half the states have raised their own state minimum wages to be higher than the federal, and so that is some positive news, but of course it takes a lot of effort to do that state by state. So now it is my pleasure to call on Dr. Anna Godey. As I mentioned, she is a research economist. She is at the Center for Wage and Employment Dynamics at the University of California-Berkeley. Her main research interests are health and labor economics, and her current projects include the effects of minimum wages on employment in low-wage areas and also parental employment, and the downstream effects of wages on health and fertility, and the effects of hospital queues on labor supply. And she received her PhD from the University of Oslo in 2014. Anna, let's turn it over to you.
Thank you, Heidi. So I'll just go right ahead with my next slide. So one concern that has been raised by practitioners during the COVID-19 pandemic is that we may see an increase in so-called deaths of despair, that is, deaths from suicide, drug overdoses, and alcohol. For instance, there's been reports of suicide hotlines reporting sometimes substantial increases in the number of calls, with many callers reporting coronavirus-related concerns. There's many possible aspects of the current crisis that could potentially lead to an increase in suicides. One set of factors are a bit unique to this pandemic, so we can think of these as public health concerns. This includes anxiety about being infected or infecting others. There's the effects of social isolation, where people are cut off physically from their support networks. The coronavirus pandemic and the social distancing shelter-in-place orders also make it more difficult to access in-person treatment for both addiction and also for mental health issues. At the same time, this is also an economic crisis. So over the last 5 weeks, more than 20 million Americans have filed for unemployment. And these job losses are disproportionately affecting low-income workers who are less likely to be able to work from home. And we know that job loss and economic uncertainty is by itself a known risk factor for suicide. So next slide. So for some further background, we know that deaths from drug, alcohol, and suicide were already at a high level in the United States before the onset of this pandemic. Over the last 20 years or so, there's been a steady increase in deaths from these causes. Suicides, for instance, are up by more than 30%, while drug overdose deaths are up by more than 250%. And what's striking is that these increases are driven by Americans without a college degree, so lower wage workers. This has prompted a discussion that the increase in deaths from these causes could be driven in part by economic factors, given what we know about the stagnating wages and increasing inequality over the same time period. So next slide. So the paper I'm presenting today is co-authored with Will Dow, Chris Lowenstein, and Michael Rice, all at UC Berkeley. In this paper, we ask how policies aimed at low-income workers may affect deaths from these causes. Specifically, we'll look at the minimum wage and the earned income tax credit. So these are two key labor market policies aimed at increasing incomes of relatively low-paid workers. So for both of these policies, there is substantial variation between states. So states can set their own minimum wages, and some states also have supplements to the federal EITC. And there is a lot of variation during the sample period in these policies, which allows us to estimate models of how mortality changes when states implement more generous policies. Next. Our primary source of data comes from the CDC, where we use the multiple cause of death data. So this is individual level data on all deaths in the United States. We focus on non-college educated adults, as these are more likely to be affected by the policies we study. And we look at three distinct causes of death. Drug overdoses, where we distinguish between unintentional drug overdoses and the intentional drug overdoses, or drug suicides, if you will. And then we look at the non-drug suicides. These are all other suicides grouped together. Next. Yeah. Oh, sorry, can you go back? Oh, it seems I'm missing a slide here, but I'll just go through it verbally. That oh yeah, there it is. That our empirical strategy leverages policy variation between states over time. So specifically, what we do is we estimate regression, event study regression models of cause-specific mortality in the years leading up to the policy change and then in the years immediately after the policy change. These models include state and year fixed effects. What this means is that we control fully for nationwide trends in cause-specific mortality, as well as factors that are state-specific and are constant over time, so level differences in cause-specific mortality between states. The models also control for a number of state policies that vary over time, as well as demographic changes. These are variables that could confound our results. In the interest of time, I'm leaving out a lot of technical detail here. That's all in the paper. What I will say is that the intuition behind these models is actually very simple. So if the policies that we study actually have a causal effect on cause-specific mortality, we should expect very little to happen in the years leading up to the policy change, and then we would expect to see a sharp change in mortality immediately or very shortly after the policy change is implemented. So that is what we'll be looking for when I move to the results. And here I guess there was a mix-up in the slide order. So if you could go back to to the one with the minimum wages. Yeah, thank you. Yeah, this one. So this slide shows the results of shows the effects of the minimum wage on drug deaths and also suicide. So the panels on the left and the middle panel are the drug deaths, unintentional and intentional drug overdoses, respectively. And we can see that these figures don't really show much of an effect of minimum wage increases on deaths from either of these causes. So for the drug non-suicide, the estimated effects are fairly close to zero through the event window. For drug suicide, there's something of a negative trend, but it doesn't seem to be discontinuous at the time that the minimum wage is increased. So we can contrast that with the panel on the right, which shows effects on the non-drug suicides. And this is rather a striking result. We see that in the years leading up to the policy change, nothing much is happening, and then when states implement these higher minimum wages, mortality from non-drug suicides, the number of non-drug suicide deaths drops sharply right at that time. We can move to next slide. Oh, the one with the EITC results. Yeah, thanks. And so this is the results for the state EITC supplements. Again, we see a very similar pattern, not much happening for the drug deaths, and a sharp drop in the drug non-suicides after the EITC is increased. And what's kind of striking with this figure is we see that there's a little bit of a lag for the non-drug suicides, where the largest effect is found not in the year when the EITC is implemented, but in the following year. That's sort of consistent with what we'd expect given how the EITC is distributed, where you get your money in the year you file your taxes, not in the year you earn the income. Right? So we'd expect there to be a little bit of a lag there. So next. We move on to the one with the, this one. So in the paper, we do a lot of robustness tests to convince ourselves that we are in fact picking up the causal effects of these policies. In the interest of time, I will mention only a few of them here briefly. So one thing we might be worried about is that states that implement more generous economic policies implement other policies at the same time. For instance, they may implement stricter gun control, or they may implement easier access to healthcare for low-income adults. And if that were the case, we might expect to see reductions in suicides for high-wage workers, so workers with a bachelor's degree or higher. We don't see that. We also don't see any reductions in sort of amenable mortality for low-income workers. So we see no reductions in cancer mortality, for instance, for workers with high school or less. So this sort of suggests that there's not some other unobserved policy changes that happen to occur right at the same time. Next. So how big are these results really? Well, our point estimates indicate that 10% higher minimum wages, or EITCs, reduce suicide by 3% and over 4% respectively. And these effects line up with exposure. So groups that have higher exposure to each policy tend to see the larger effects. So effects are on average a little bit larger for women, lining up with what Heidi said, that women are overrepresented in minimum wage jobs. To get a bit of more of a picture of how big these effects are, we estimated simple policy simulation using the estimated regression models to calculate the predicted number of suicides under a counterfactual policy where we eliminate all state minimum wages and EITC supplements. That is, we pretend that the federal policy floor is binding across all states. And these policy simulations indicate that the state minimum wages and the state EITC supplements together prevented more than 10,000 suicides during this sample period. Next. So to conclude, in this paper, we asked whether labor market policies aimed at low-income workers could reduce deaths from drug overdoses and suicides. Well, we found no evidence that these policies reduce the number of fatal drug overdoses, at least in the short run. We did find significant and immediate reductions in the number of suicides. I've been trying to think of any lessons for the present moment, and that is really challenging given how unique this crisis is. However, it's worth noting that the policy response we've seen so far does include significant income support for later workers. Our findings suggest that these policies may mitigate any increase in suicides, in particular if we believe these reports that the anti-COVID measures, if you will, could increase suicide susceptibility, then these income support policies may be even more important. Thank you. Heidi, are you there?
I forgot to unmute myself. This is Heidi Hartmann coming back. Hello. Before I introduce Lindsey Bullinger, I did want to recognize the Urban Institute. And before I was acknowledging the IWPR staff, and I want to say that the Urban Institute administers, really, has the National Coordinating Center for all of the Policy for Action programs, including the hubs. And they are helping our hub with this webinar and with others, and we very much appreciate their help publicizing the webinar. So at this time, I was also saying, Anna, to you that your presentation was very, very interesting, and we were going to take the questions and answers later, unless someone had a technical question, which Jeff Hayes would have told me about. So now we'll go on to Lindsey Bullinger. As I mentioned, she's an assistant professor in the School of Public Policy at Georgia Tech in Atlanta, Georgia. Her research examines the effects of public policies on child and family health and well-being, with a focus on children from low-income families. Dr. Bullinger earned her doctorate from Indiana University in 2018, and her topic is on whether the minimum wage affects child well-being. Lindsey, let's hear from you.
All right. Thank you, everyone, for joining today, and thank you for having me. Next slide. I'm going to start out with some background on child abuse and neglect. since this is mostly a minimum wage webinar. So it's estimated that about 37% of all children are the subject of an investigation by Child Protective Services agencies by the time they reach age 18. So this, next slide, is 1 out of every 2.5 children, which is a lot of children. So this child maltreatment is a very pervasive problem in the U.S., and we know it has some both short-term and long-term consequences. Next slide. So for example, in the short term, we know that children who are the victims of abuse and neglect experience attachment problems, they have worse cognitive development, and they have impaired social functioning. Next slide. In the long run, children who are the victims of abuse and neglect experience depression and behavioral problems at greater rates. They have worse health. They experience unemployment and poverty at higher rates. They are also more likely to use social services. And lastly, they are known to commit more crimes than children who have not experienced maltreatment. Next slide. It's also a very costly problem. A recent study estimated that child maltreatment in the United States cost society about $428 billion, in large part due to these long-term consequences. Next slide. Children, however, are not all equally likely to be the victims of maltreatment. So, for example, children from low-income households are substantially more likely to experience and to be the victims of child abuse and neglect than children from high-income families. This is in large part driven by exposure to neglect, but it is prevalent among all different types of abuse, including physical, emotional, and sexual abuse. Next slide. The highest risk group for child abuse and neglect consists of children who are living in single female-headed households. And this is important in the context of the minimum wage because, as has already been mentioned before, next slide, the typical minimum wage earner is typically a woman who is responsible for running a household and raising children. Next slide. So as a result of the group that is expected to benefit the most from a minimum wage increase and the group that is at risk of perpetrating child maltreatment, of this overlap, this is why we started investigating this relationship between minimum wages and child well-being, broadly speaking. Next slide. In some earlier work, my colleague Carrie Racian and I we produced a study on the effects of the minimum wage on child maltreatment, and we saw a $1 increase in the minimum wage reduced child maltreatment by about 10%. This was largely driven by reports of neglect, and these were very strongly prevalent among very young children, so children between ages 0 and 5. Next slide. So in that study, we could not, unfortunately, determine how a minimum wage increase affected child maltreatment, which is in large part the goal of this current study, which is noted on the first slide, is preliminary work. It has not been through the peer review process. So the rest of this talk, I'm going to focus on this particular study, in which we use a representative sample of children who were born in urban areas across the country, born between 1998 and 2000. So this is the Fragile Families and Child Wellbeing Study. And our sample size ends up being about 1,000 to 2,000, depending on the outcome of interest. This is a longitudinal cohort-based study, so it follows these children who were born in between 1998 and 2000, all the way through, at this point, age 15, though the data that we are using for this particular study focuses on children between ages 3 and 9. Next slide. So we merge these data on child well-being with state and city level minimum wages at the time that the survey took place. So these surveys were taking place between 2000 and 2009 roughly, 2010 roughly, and so at the time that the survey was taking place is the variable that we use for the minimum wage level. Next slide. The outcomes of interest are various measures of adverse parenting. So it could be perceive that minimum wages affect both sort of physical behaviors, but also not necessarily what parents do, but what they say. So we have a measure of spanking behaviors. We also have a measure of physical aggression, which is hitting of a child in any other way that is not considered spanking. We also have a measure of psychological aggression, which is more like how a parent verbalizes with a child. We also have a measure of physical neglect, which is what we know in the child well-being literature to be the inability or not providing sort of basic necessities, things like food and clothing to a child. And then lastly, we have a measure of supervisory or exposure neglect, which can be thought of as leaving a child alone when the child should not have been left alone. Next slide. As I noted, however, this study is largely trying to understand precisely how the relationship transpires between a minimum wage increase and child well-being. And so to do that, we have various measures of some potential mechanisms. So for example, we first have a measure of household income as sort of a direct relationship between a household being able to provide for a child. Additionally, we have various measures of employment. So we have whether an individual, a parent worked, and then we also have when they worked, in particular whether they worked at night or on the weekends. And so really trying to understand the different shift premiums here. We also have some measures of maternal mental health. And then finally, we have some measures of child behaviors, particularly thinking about sort of outbursts among children, which we refer to as sort of these externalizing behaviors. Next slide. All right, so next I'm going to present to you some of the main results from this study. I'm presenting them in the form of bar graphs for easy interpretation, though I've skipped over a lot of the details of the empirical analysis, but I'm happy to answer any questions should they arise. Next slide. All right, so a $1 increase in the minimum wage reduces spanking by about 10%. And so next slide, these three bars show you that this first bar is among 3-year-olds. Next slide. The second bar here is among 5-year-olds, and this third bar here, next slide, is for 9-year-olds. So the reduction in 10% is an average across all three of these different groups. So you can see that the spanking really, the reduction in spanking really occurs between 3-year-olds and 9-year-olds. Next slide. All right, so these next results are primarily among 5-year-olds and 9-year-olds, just due to when these particular questions were asked throughout the lifetime of the study. And so we see that a $1 increase in the minimum wage reduces physical aggression by about 24%. So again, this is sort of hitting a child in any other capacity that would not be considered spanking. And this is largely prevalent among 9-year-olds, and we see really no effect among 5-year-olds. So the no effect here is what that gray bar represents, whereas the yellow bar represents a significant effect. Next slide. We also see that a $1 increase in the minimum wage reduces psychological aggression by about 12%. And once again, this is driven by 9-year-olds primarily. We see no significant relationship between increases in the minimum wage and psychological aggression among 5-year-olds. Next slide. Finally, we see no effect on physical neglect, which again is the provision of sort of basic needs, things like food and clothing and shelter. And then next slide. We also see no effect on supervisory neglect. This would be leaving a child unattended when they should not be. And so this is consistent here both across 5-year-olds and 9-year-olds. So thus far, these results have really just reflected sort of or been consistent with our earlier study. The main contribution of this particular study that's, again, in progress is really understanding these mechanisms here. Next slide. So the first finding that we have on mechanisms is that we actually do not see an increase in the minimum wage on household income. So even though these bars are, at least among 3 and 5-year-olds, in the positive direction, whereas 9-year-olds it's in the negative direction, none of these estimates are actually significant. So we find no effect on household income. Next slide. We do, however, see reductions in paid employment in the past 2 weeks. And this is largely among, the sample at this point is largely single female-headed households, though not entirely. But this is a reduction here in the past 2 weeks of about 6 or 7%. And the 2 bars here, the 2 yellow bars here, represent that these effects are primarily driven by age 5 and age 9. Next slide. We also see a reduction in working evening shifts by about 26%, though that is only relevant among the 5-year-olds, not the 9-year-olds. So this suggests to us that the premium that is normally placed on evening shifts is lost when the minimum wage increase, or at least it's reduced. And therefore, mothers in particular choose to work other times of the day. Next slide. We do not, however, see any effects on whether a parent works weekend shifts, and this might be reflective of the different types of jobs that are on the weekends versus nights. Next slide. We also see no effect on maternal depression, and this is at any child age. Next slide. And lastly, we see that a $1 increase in the minimum wage reduces children's externalizing behaviors by about 14%. This is largely driven by 9-year-olds. We see no significant effect here for 5-year-olds. And again, what I mean here by externalizing behaviors is that children are acting out less, they're experiencing fewer outbursts, fewer sort of meltdowns, if you will. I have a toddler at home during this crisis, so I know all that all too well. So we see this reduction is largely among 9-year-olds and not 5-year-olds. Next slide. All right, so to conclude, we see that a $1 increase in the minimum wage is associated with a lower likelihood of spanking by about 10%. Next slide. We also see reductions in physical and psychological aggression, primarily among older children, 9-year-olds, for example, and we see no effects for neglect. So these results are in some ways consistent with our earlier study of seeing an increase in the minimum wage, reducing reports of maltreatment, though it is transpiring a little bit differently among this sample than it was in the earlier study. Next slide. We believe that some of the possible mechanisms for increasing the minimum wage include reduced employment. We also see fewer evening shifts among working parents. And then we also observe fewer externalizing behaviors among children. We do not see any effects of the minimum wage on income or maternal mental health among this particular sample of low-income families in the Fragile Families and Child Wellbeing Study. Next slide. Thank you very much. I am happy to take any questions related to any of the empirics or also any of the implications.
Thank you very much, Lindsey. Also a very excellent presentation showing, like the previous one, some quite large effects of these state minimum wage policies, which is wonderful to see. I think since we don't seem to have technical questions yet for you, we'll go on to hear from Paul. He's the, as I mentioned, the State Policy Program Director at the NELP and Director of the NELP Action Fund. NELP is a very important nonprofit organization. If you don't know it, but I'm sure most of you do, it works both nationally and at the state, and it looks at very, very many public policies related to employment and workers' rights. And it also does conduct policy analysis and research from time to time. So, Paul, thank you so much for joining us.
Great. Thank you, Heidi, and IWPR. It's really terrific to be here this afternoon and to speak together with this really wonderful group of panelists that you've assembled. I'm going to address the need for raising wages during the COVID crisis, and in that context, the relationship between higher minimum wages and some of the health impacts that the other panelists have described in their very important research. My main point today is that the need to raise pay for low-wage workers is more urgent than ever right now during the COVID crisis and the recession that will follow it. Far from being a reason to pause action on higher minimum wages, the COVID crisis has instead illuminated our economy's deep racial and economic inequality and the pressing need for higher pay to help workers and families weather this crisis. Next slide, please. As most of you know, since 2004, there's been a tremendous wave of action across the country to raise the minimum wage to $15 an hour. It was launched by the Fight for 15 movement, backed first by fast food workers and then by workers across the economy. And that strong worker organizing from coast to coast has resulted in more than half of the states raising their minimum wages. And in particular, today, more than 1 in 3 U.S. workers are now in states that have approved and are phasing in $15 minimum wages. At the federal level, we saw last summer the House of Representatives pass the Raise the Wage Act, the first federal minimum wage increase to clear either house in more than a decade, building momentum for long overdue action on the significantly eroded federal minimum wage that Heidi gave you data on during her intro. But since the COVID crisis launched, we've seen sort of a new frame in the debate around raising wages. On the one hand, we've seen business lobbyists, particularly led by the restaurant and hotel industries, pushing to delay the $15 minimum wages that have been approved in recent years by states and cities. There's a push in California by those lobbyists to urge Governor Newsom to pause that state's $15 minimum wage. There are similar lobbying efforts by business groups at the city level in California and across the state. And we saw in Virginia last week that kind of the restaurant lobby and others persuaded Governor Ralph Northam to delay that state's new $15 minimum wage from starting implementation. They delayed it about from January 2021, pushing it back to May of 2021. At the same time, however, we're seeing also growing calls for raising pay for frontline workers during the pandemic, citing the crucial role that workers in hospitals, nursing homes, grocery stores, and other sectors are playing during the crisis. Policymakers from Chuck Schumer and Elizabeth Warren to Andrew Cuomo to city leaders in a variety of states, including New York and California, are all calling for requiring higher premium pay, or sometimes called recognition pay, for these frontline workers. So this is really the new frame in which we're finding the minimum wage debate. And I'm going to make the case that the COVID crisis really is underscoring why we need to keep deliberately raising wages for workers at the bottom, and it is by no means a reason to pause the action and progress that states and cities have been making towards raising wages in recent years. Next slide, please. So, the COVID crisis has laid bare the conditions of jobs at the bottom of our economy and the deep racial, gender, and economic injustice of our workplaces. Those jobs are characterized to a large degree by unsafe working conditions, by very low pay, by lack of benefits and paid leave, by eroded worker power. Only a vanishingly small share of private sector workers are represented by unions, and very few workers feel safe to speak up, to complain about conditions on the job or organize for better conditions. And the major impact of these conditions at the bottom of our economy is felt by women of color. They are disproportionately concentrated in these jobs, and and are bearing the brunt of what our low-wage labor market looks like. Next slide, please. Low wages and incomes are also really emerging as a major factor, making families more vulnerable during the COVID crisis. And I'm going to focus on Black and Latinx households because they are the lowest income households in our economy, and the households where low-wage workers are most concentrated. One way this is happening is Black and Latinx households are facing higher incidence of job loss, making those households more reliant on the remaining household members who are working and on their paychecks. The second way is Black and Latinx households have far less savings and wealth due to structural racism and other deliberate policy choices, including housing policy choices. And that leaves them far less of a cushion to rely on during a crisis such as this. And then third, Black and Latinx households are very disproportionately underpaid for work that has always been valuable, but it has not always been respected. And so these are all ways in which the very low wages that many workers receive in our economy are exacerbating the impact of the COVID crisis. Next slide, please. So, frontline workers are providing crucial services during the crisis. Many of these jobs are ones that are now being labeled essential, are the same ones that before the crisis were functionally treated as disposable, and are the jobs characterized by the conditions we just discussed in the previous slide. The workers in these sort of frontline jobs are very disproportionately Black and Latinx. According to recent analysis by the New York Times, women of color are most likely to work in these so-called essential jobs. And these jobs are concentrated in low-paying industries where the minimum wage effectively sets pay scales. Those are industries like grocery and retail, long-term care, such as nursing homes or home health care, takeout, delivery, and manufacturing. Next slide, please. So this reality, we believe, makes clear why we need to keep raising wages for frontline workers during the COVID crisis and the recession. And that means continuing to phase in state and local $15 minimum wages rather than pausing them. It means continuing to make progress on long overdue action on the federal minimum wage, which should be raised to $15 or even more, frankly. And also this means moving forward with premium pay or recognition pay raises for the frontline workers as federal, state, and local policymakers are proposing. And these premium pay initiatives really are starting to gain momentum. More and more lawmakers are calling for them. We're seeing more proposals introduced. The New York City Council introduced one yesterday that would require raises of extra pay of between $30 and $75 a shift for workers in essential jobs for the duration of the emergency, and it's really something that I think we're going to see some of these policies start to be approved in the coming weeks and months. Next slide. And the recession makes continuing these raises even more urgent. It's important to note that gradual raises are not a significant burden on corporations. All of these minimum wages are phased in very, very gradually, and they are not appreciable additional cost for employers. The second key point is with family members out of work, those frontline workers who are working need higher wages more than ever. And the third point is we believe that public opinion polling shows there's more public awareness about worker injustice and the struggles of underpaid workers, and the consumers are really very open to accepting even marginally higher prices if that's associated with continuing to raise pay for frontline workers on whom we're all relying during this crisis. We've seen that in polling supporting these recognition pay proposals for frontline workers, but also in general, just public sympathy for workers struggling during this economy. Last slide, please. And which brings us around to the health benefits of higher wages that the other panelists have spoken to. They are especially crucial during this recession. Households with low incomes are under greater stress than ever from sickness, joblessness, and juggling family demands, including those with kids out of school and the like. As panelists have explained, higher pay improves health outcomes for all workers in a range of important ways, and is really these are among the very many crucial benefits of raising pay across our economy, and are very, very broadly popular. Okay, so that's my last slide. I think I will break off now, and would love to answer questions that the audience may have, or that my fellow panelists may have. Thanks again for the opportunity to join you here today.
Thank you, Paul. Excellent overview of the kind of arguments that are now being raised against the minimum wage, and how in the COVID environment, perhaps analysis and arguments need to change a little bit. We may have also some questions from others that are busy typing into the chat area. And Jeff Hayes is on the line. So Jeff, what can you tell us?
Great. Well, thank you. I'd like to thank the panelists as well, Heidi, just because it's been really interesting and fascinating to hear all three of them. And it's just great to see new research coming out in this area, and to be looking at the health impacts. I think it's really a great sign of progress. I'll start with, I think, they go in order kind of. Start with Anna, and one of the questions that came in was, were you able to detect any differences across sort of the level of the increase in the minimum wage, or were you strictly looking at when it went up and that it went up?
Thanks for that question. It's a really interesting question, because we might expect that effects differ for sort of the low end versus the high end of minimum wages, especially if we might worry that if the minimum wage it's very high, that the consequences may be different than if it is a lower level. The short answer is no, that in this paper we did not differentiate between higher and lower levels. So I will say that during this sample period, the real minimum wage sort of expressed in 2016 dollars is between $6 and $10. So that's sort of the level that we looked at.
Okay. And how did you treat multiple increases that happened within the window?
So the way we treated the events was that if a state had a minimum wage increase, we first required that there was at least 2 years prior to that increase when there was no change in the minimum wage. And that's because we want to have a sort of a clean pre-increase window to validate our models, if you will. And then if there was a phase-in, so like the last speaker alluded to, these minimum wage policies are typically phased in over time. So that will show up as small increases each year of the phase-in. We treated those phase-ins as a single event, so starting with the first year of the initial increase. And then if a state had two, I believe there's a few states that have two qualifying events during the sample period, then we just treated those as separate events.
Okay. Great. That was my question, by the way. I was curious. Then the next questions that came in, there were sort of two that were fairly a bit similar for Lindsey. And the one was sort of around the messaging in the upfront material. And the question goes, is it possible that abuse and neglect occurs in higher socioeconomic families, but the incidents are less likely to be reported? Also, how can we be sure not to pathologize single mothers who are heads of households and linking them to these statistics as these studies are carried out among urban populations?
So these are great questions, and there are a lot of people that are doing research in this particular area. And it's true that we suspect that children from low-income families are reported more for maltreatment, primarily because they are also exposed to more mandated reporters, for example, because they interact with people in public offices at higher rates than children from higher income families, and for other similar reasons. There is some research to suggest on both sides that this is a true phenomenon, that children from low-income families are, in fact, reported at higher rates, despite potentially not necessarily experiencing maltreatment at higher rates. But there's also research to show that these trends in reports are very highly correlated with other measures of maltreatment that wouldn't necessarily show the same sort of reporting biases. So, for example, fatalities due to maltreatment doesn't necessarily show a reporting bias, but also trends very similarly with maltreatment measures. So it's true that it could be true on either side. We have evidence for both. So it's sort of still out for debate. Nonetheless, the data that we are using in this particular study are not maltreatment reports, so they would not be subject to these biases. They are self-reports, so they're subject to other set of biases. So the framing is mostly to sort of motivate that we see a lot of these reports for children from low socioeconomic status families, and the question is sort of whether there are policies, for example, like the minimum wage, that could potentially either reduce those disparities in either true incidents of maltreatment or reduce maltreatment overall, or have other effects on maltreatment. And that was sort of the motivation for this these series of projects to begin with, because it's not necessarily clear ex ante if these policies would reduce maltreatment. So that, I think, answers the first question. Can you just remind me of the second question?
Okay.
How to prevent
how can we
stigmatization?
What, Heidi?
I said how to prevent stigmatization, not just rephrasing your question, which was to not treat them as pathological.
Based on what's in the Fragile Families data too, I think, sure that it's that it is a bit targeted as a population, isn't it?
That's right. So I think perhaps maybe the implication here is the generalizability of this study. So in this particular study, we are looking at families who were in the Fragile Families and Child Wellbeing study, who the mother has a high school or less education level, so as to try to really get at the individuals and the families that would be most impacted by changes in the minimum wage. So it ends up being in this study a large fraction of single female-headed households, but they're certainly not the only ones in this study. It just, in this particular sample, which starts out and when weighted is nationally representative of children who were born in urban areas in the early parts of the 2000s.
Right. We also have been receiving, also for you, Lindsey, so stand by, several questions about sort of the interesting findings that you had about, even in light of a minimum wage, that you didn't see the increase in household income. Was there an impact or was there a reduction in hours that you could track? And if so, could you tell if that was voluntary or not?
Yeah, that's a great question because we also were sort of interested in this particular finding. It was a bit surprising to us as well. So just to recap, our findings are that we do not see a significant increase or decrease in household income. Now that is an annual measure of household income. And so to the second part of this question is we do see a reduction in employment in the past 2 weeks. So this is a binary variable. If we want to get very technical here, this is did you work for pay in the past 2 weeks? And we see a reduction in respondents saying yes to this question by about 6 to 7%. Unfortunately, we do not know if this was voluntary reduction or if this was forced reduction. So what we are able to sort of surmise when we combine these two findings is that it's possible that families sort of have an income that they want to achieve, and if they experience an increase in their wages, they can then reduce their hours voluntarily. Alternatively, it could be a forced reduction based on an employer's response. So we unfortunately we're unable to decipher at this point which of those two it might be or other potential combinations. But what we do know is that from this particular study, we see no significant effects on household income. That's an annual measure. But we do see these reductions in whether a respondent reported they worked for pay in the past 2 weeks.
Okay, great. Just passing on a comment that we received, I just wanted to say thank you, and this is the quote, "Thank you to everyone. This is fantastic content, and I'm a content snob, so thank you again to all the teachers." That was, again, self-identification on the content snob part. There's a question I think everyone could probably weigh in on in terms of how it relates to their research and then Paul's comments about the policy field more generally. Attempts to how did the research you did and what's going on with, I guess, the sub-minimum wage and tipping restaurants in terms of what the minimum wage is and when it changes, and the impacts that you've seen, and whether you could, again, feel free to tell us about other research you've done or know about.
This is Lindsey. I can chime in here that we in this both this study and the earlier study that we've done, we have done sort of the highest minimum wage that would be applied to the most workers. So to be sort of more conservative. So we do not in these studies we do not pay attention as closely to the tipped wage. Just because oftentimes we don't have that sort of information about which type of minimum wage would be applied for each individual worker. We don't necessarily always have that information, so we have to make methodological choices that move the research forward.
Thanks.
I think some of Anna's, this is Paul Son, some of Anna's colleagues are, Sylvia Allegretto are the kind of leading researchers on some of those tip wage issues. I'm sure, direct folks to Sylvia's research is a good place to look.
Do you know of any health impacts coming out of that, Paul or Anna?
I'm not aware of that, but
okay.
Yeah, definitely talk to Sylvia Allegretto. She's your person on the tip minimum wage. I should say we also didn't look at that specifically in our study.
Are there any shifts that you know about in that? I mean, the one fair wage work and things like that, Paul, that we should be aware of?
Yeah. So in terms of policy, yeah, there's, the sub minimum wage for tipped workers is just abysmally low and is fueling high poverty rates among wait staff. But it's so politicized, and the restaurant industry is so dug in around it that it's proven very stubborn to eliminate. There has been some incremental progress. Actually, New York abolished it for outside of the restaurant industry recently. Governor Cuomo did, or there was a combination of legislative and DOL action. And there are some cities that have gotten rid of the tip minimum wage, and there's been no evidence of it hurting the restaurant industry. One of the interesting ones is Flagstaff, Arizona, which is in the process. I think maybe they've already fully eliminated the tip minimum wage, and there's no evidence that it's harmed the restaurant industry. So there has been some progress, but not as much as we need.
This is Heidi. I could just add that there are about a handful of states, aren't there, that don't have a tip minimum wage, where everyone does get the same minimum wage, and they're generally in the West, as I recall. It's about 5 or 6.
Correct. Yeah. There's something like maybe 7 or even 8 from California, Minnesota, Alaska, Montana, a bunch of states. And there's no. Tipped workers make the base wage with tips on top of it, and the restaurant industry scare tactics that it will lead for in restaurants to abolish tipping and that workers will end up worse off have not materialized. If anyone's dined out in Las Vegas or Los Angeles or any of those places, there's tipping there like there is everywhere else.
Great, thank you. And then there's a question for Anna. In the suicide study, what are the gender differences? And can you talk about any of the demographic differences that you could or couldn't find, or other studies?
Yeah, so I'll just start with a caveat there that women have lower baseline rate of suicide than men, so the numbers do get small once we start breaking it down by demographics. That said, we do see that the effects are a little bit larger for women than for men, though the difference doesn't quite reach conventional levels of statistical significance. Moreover, when we split it by gender and age, we see that the groups that are more exposed to each policy have the largest effects. So what I mean by that is when we look at the minimum wage, we see the youngest groups of adults, so adult ages 18 to 24, have with high school or less, have the larger effects. When we look at the EITC, it's mostly women who are a little bit older, so 25, so 20s and 30s, who are more likely to have qualifying children, who have the largest effects.
Great, thank you. That's really interesting. I didn't realize you'd been able to dig down that far, I guess. So then, I think this question could be answered by anyone on the panel who has any information would be welcome. Any comparisons with other countries in terms of wages and industries and how they are doing during this crisis? I think that we're talking about wages, I guess, so I don't know if we know what other countries are doing around wages and work.
Well, this is Heidi. I was just going to say that other countries seem to be more focused on keeping people on the payroll and subsidizing the wages. We have a policy that the Congress passed, but it's having trouble reaching the employers, and the employers would have to keep the workers, take out a loan, and then they wouldn't have to repay the portion of the loan that is based on keeping workers that they would otherwise lay off. But it's a longer process to make. It takes longer to get from that policy to it being implemented here in the States than it does in other countries where they routinely handle unemployment that way, trying to keep people on the payroll and subsidizing the businesses to keep them on the payroll rather directly, I believe. But Paul, that might be something you do know a bit more about.
Yeah, I was going to make the same point, and it's it seems like a more more effective approach. And there's been some interesting bipartisan support. What was it? Republican Senator Josh Hawley, he had a proposal for something similar to that, although it's very uncertain whether it'll get any action at this point. And one thing I would note also just about the context. I mean, sort of back on the industry push to slow down the minimum wages that I spoke to. Any impact that would have on benefiting the restaurant industry or others would be just infinite. Would be so tiny. I mean, the real problem they're facing is lack of consumer demand because of all the workers out of work. Those industries should instead be doing is lobbying for unemployment insurance extensions and continued more generous unemployment insurance benefits, which is what they really need to get consumers spending again, as well as obviously ending the quarantine.
Right, and unfortunately, ending the quarantine requires a number of policies that we don't have in place, like much more robust testing, contact tracing. Countries that have used testing and contact tracing have not had to do as much lockdown as we've done here in this country. So, because of our public health system not being really prepared for a pandemic at this level, we're caught a little bit behind with definitely inadequate demand. Even people who have money are not spending it. There's only so much, I guess, online shopping people want to do when they're so limited in the activities they can undertake. Retail has fallen off as well as restaurants.
Yeah, no, good point. Thank you, Heidi. I wasn't suggesting prematurely ending the quarantine, but just pointing to what really is the problem for employers. It isn't the minimum wage. So.
Right. I certainly wasn't thinking that you were pointing to premature. I just want to emphasize again that the findings here are really remarkable. These are large findings that both Anna and Lindsey told us about. I mean, in the one case, state EITCs, which really are relatively small compared to the federal EITC, and state minimum wages, which of course are where the action is since the federal minimum wage hasn't increased, are together have prevented 10,000 deaths by suicide. That's pretty remarkable, even over a multiple year period. And then secondly, that neglect or maltreatment, whichever one it was, I'm sorry, Lindsey, maltreatment maybe declined by 10% with a $1 increase in the wage. And that you found that although the hours that were reduced, also night shifts were reduced, and that could be one of the mechanisms by which a higher minimum wage is helpful, people not having to take night work, which might sometimes have a premium. That may be why people took it. So I think these are, really important and really point to the importance of raising the minimum wage for health, and something that we can keep in mind in this pandemic. I think you made some good points, Paul, about how the one remaining worker in the family, needs a better wage. And hopefully when they go back to being able to have multiple earners in the family, those wages will help more people get into the middle class.
So I'm only seeing one more question, but I also, sorry, Heidi, did you want to go?
No, go ahead. I was going to ask you if there were any more.
I was going to say, I also wanted to just remind people that the webinar and the recording will go up on the IWPR website, www.iwpr.org. I'm not sure exactly when, but it'll be up there in the near future. And then the last question I'm seeing is about the impact on businesses post-COVID. It was targeted at Paul, about corporation experience, a little impact with phased wage increases. Do you know anything about differences for small businesses and how we balance their survival with the health and well-being of workers?
Yeah.
And any sources you can recommend are welcome.
Yeah. I mean, small businesses obviously do have smaller economies of scale to spread costs over. So, costs are going to be somewhat higher. That said, the portion of a operating cost structure that minimum wage increases represent are very, very small. Anna's colleagues at UC Berkeley have done a lot of the modeling of what the impact is by industry as you phase in a $15 minimum wage increase, which is typically phased in over something like 5 years, and it's just typically in each year it's in the range of a % of operating costs, often less than that. So it's a very small cost in the grand scheme of all the things that are putting cost pressure on small businesses. So it's really what we need are assistance to small businesses with getting consumer spending going again. We need a national healthcare policy that unloads healthcare costs, which are really far higher than the minimum wage. Many small businesses are being squeezed by urban real estate costs and the like. Those are the real cost economic stressors on small businesses, and as well as competition from Amazon, and the like. And the minimum wage is ultimately a very tiny factor, and sort of using. We need to be sensitive to the needs of small business, but if you actually look among small businesses, there's actually very, very strong support for phased-in minimum wage increases. The opposition is really the big chain, hiding behind small business, but it's the lobbyists for Applebee's and for Walmart and some of the home care chains that are often really driving the most vociferous opposition to the minimum wage. And there are a lot of small business owners that actually think it's fair and manageable to raise the minimum wage.
Great. So I think that's it for all the questions. I apologize if I mushed some together that you feel like yours didn't get answered. But I think it's back to you, Heidi, and we can close out and be on time.
Mm-hmm. Yes, thank you all very much. Again, I'd like to thank the IWPR staff, the Urban Institute, our partners at UC Berkeley, and our presenters who are all fantastic with really some very important research. I mean, we don't get size effects like these very often, so it's a thrill, really a thrill to hear about them. And to all of the participants, thank you for listening. Thank you for participating. Thank you for your great questions. And don't forget our next two webinars, Thursday, May 14th, same time, 2 p.m. Eastern, Work Scheduling and Health, and Thursday, June 4th at 2 p.m. Eastern, the Earned Income Tax Credit and Health. So we look forward to having you back with us then, and thank you, everyone.
Thanks so much.